Welcome to the ER Nursing Selective. My name is Dan Weberg. I will be your instructor. I have been an emergency room nurse for 5 years. I worked at UCLA Medical Center in the ER as a new grad, and then came back to Arizona and worked in Scottsdale Healthcare for the remaining 4 years. I am excited about this class. It's the first time it's ever been taught, and I'd like to give a brief introduction to what we're going to be doing. Online you can see the syllabus and the topical outline. Your grade depends on 2 discussion boards, 3 or 4 quizzes, and 2 group case studies. You have been assigned groups. If you go into the group tab, you can see what your group is. When it gets closer to that assignment, I will be sending you a triage note, and you will have to come up with the top 3 medical diagnoses for that patient based on their symptoms. And then you're going to come up with, for each one of those diagnoses, 3 nursing interventions and rationale. And there's an assignment description that describes that. After every 2 or 3 modules, you're going to have a quiz. That's an online quiz. It's open book, open note. I'd like you to take it by yourself, but you can take it as many times as you want. What I really want you to do is get the content out of it, and that's graded, and that goes on Blackboard as well. You have 2 discussion boards. The first one starts next week, and you will be talking about kind of your preconceptions about emergency nursing, what you want to do, what you want to learn, so we can direct the course related to what you need. And then at the end, it's going to talk about what you've learned and kind of reflect back on what you think about emergency room nursing. The next thing that we're going to be doing is the modules. Each week has a module, and it's based in systems. You're going to be given lots of YouTube videos, multimedia presentations, resources from the web, and you need to look at each one of those and get the content out of it, and then your quiz will be based on the content. The one thing that's required every single week that I'd really like you to focus on is a triage module. There you're going to go in and you'll be presented with 3 patients. You're going to select which, you're going to prioritize them and which one you'd see first in the emergency department. You're going to actually assign them a triage score based on the ESI score you'll learn next week. And then you're going to look at the interventions. This is an interactive module, and for each week you need to do that because a lot of the quiz content is based on those modules. If you have any questions, I'm going to try and give you a video update every week, but I'm also available by email. My office is in the new building on the 1st floor, room 113. And I look forward to having you guys in my class.